Otoplasty. Dressings. If a dressing is used, it should be left on until the first follow-up visit. Sutures. Sutures dissolve in about 2 weeks. Wound care. Incisions should be cleaned with water and coated with antibiotic ointment 3 times a day. Activity. Increased activity is tolerated with no heavy exercise for 2 weeks. Elevate the head of the bed 30 to 40 degrees and sleep only on your back for 1 week. What to expect? Swelling, bruising, and mild bloody drainage from incision site is normal. Bathing. Avoid wetting head and face. Clean face with hand washing and washcloth. Signs of hematoma. Painful extreme swelling and hardness, often accompanied by bruising, usually unilaterally, causing asymmetry. Please notify us if you have any symptoms you are concerned with. Please purchase these items before surgery. Prescription medication: ciprofloxacin, antibiotic ointment, bacitracin, peroxide,